One thing as we kind of wrapping this up, here's a question that not everyone will have access to you, right? And you are specializing in melanoma, you're specializing in this field. So what should a patient be looking for when they go and see a physician or dermatologist, especially a dermatologist for a skin check? How do they know, they're getting a thorough exam? How do they know that, this is the right doctor for them?
Well, that's a great question. Um, it's very kind of you to say not everybody has access to you. There are some people who need access to a tertiary care center, such as us, or to you, Dr. Wang, or people who are used to taking care of high risk scenarios. But most people don't need that, and most dermatologists are really good and really caring. And more primary care doctors are acquiring the skills to do the
Yep.
screening. But what I do is when I have a patient that's saying, goodbye, Dr. Swanson, I can't see anymore. I've had an insurance change. I first of all I say, well, I'll see you in a couple of years when the insurance changes back, because I've been around this long enough to know that merry-go-round exists, and that happens not frequently. But I basically, when they say, how do I find a dermatologist to take care of me? I say, well, number one, ask your primary care doc who they would go to. That's a great thing to do. When your doctor says, oh, my family goes to see so and so, basically you call them up. But I wouldn't stop there. When I call them up, I would say, hi, I'm just curious. Does your doctor do dermoscopy? Does your dermatologist do dermoscopy? And if they say yes, you're golden. Go on in there and see them, because once dermatologists start doing dermoscopy, they realize, as you alluded to momentarily ago, you can't practice without it. I can't
Yeah, I
practice
agree.
dermatology without it. I mean, it's like the field has evolved so much with that in that context that's just the way it is. But if they say no, our dermatologist doesn't do the dermoscopy, you say, oh, okay. Well, thank you very much for your time. It has been a pleasure speaking to you today. Have a nice one. And hang up and find the next dermatologist until you find somebody who does that, because this is 2022 and soon to be 2023. You need to see somebody who has that skill set.
So maybe,
Fortunately,
no, go ahead.
fortunately, Fortunately, 98 plus percent of dermatology residents who graduate now have at least some training in dermoscopy.
Yeah. So that's a good